We've all been there, that deep, chest-rattling hack that leaves you completely exhausted. When you're staring at a pharmacy shelf trying to find relief, the first question you need to ask isn't which flavor to pick. It's whether you actually want to stop coughing or encourage it. Medical science divides cough medicines based on a very simple Latin word, tussis, which translates directly to cough. As you can see in this diagram of the nervous system, drugs called antitussives act as a biological mute button. When a cough is dry, scratchy, and painful, these medicines target the nerves between your throat and brain to block the signal. But down here in the pulmonary system, things work differently. If your lungs are full of thick fluid, you don't want a mute button, you want a broom. Medicines called expectorants thin out that rigid mucus and trigger a productive cough, so your body can sweep the debris up and out of your airway. Long before modern labs were mixing synthetic syrups, traditional medicine relied on the complex engineering found in nature to perform this exact sweeping action. Getting better requires giving the lungs the precise mechanical tool they need to clear the path. This brings us to our first natural tool. This botanical illustration details the broad, green leaves and stem structure of the Vasaka shrub, known scientifically as Antitussive Vasaka. Both the fresh and dried leaves of this plant have been harvested for generations. The power of these leaves comes from an internal chemical engine. They contain a specific class of compounds known as alkaloids, specifically one called vasacine. Looking at this constricted airway, vasacine acts as a bronchodilator. It expands the inflamed tubes, creating space for sticky mucus to break apart. It also triggers rhythmic squeezing in the surrounding smooth muscles, pushing the mucus upward and out. The compounds in Vasaka also reach beyond the lungs. They lower acid formation in the stomach to calm indigestion and reduce inflammation in the sinus cavities. This combination of lung clearing, acid reduction, and sinus relief makes Vasaka a versatile tool for addressing multiple symptoms at once. Moving away from leafy shrubs, we find a different mechanism hidden in the heavy wood of the Myroxylon balsamum tree. When the bark is scored, it yields a thick, golden, sticky sap known as Tolu balsam. Unlike the alkaloids in Vasaka, this sap carries a rich payload of chemical compounds called esters, along with small amounts of naturally occurring vanillin. The esters in Tolu balsam break down rigid mucus blocks while simultaneously acting as an antiseptic to neutralize bacteria inside the chest. Because of its natural vanillin content, this protective sap carries a sweet scent and pleasant flavor, making it far more palatable than many other raw medicines. This split view shows how widely adapted it became. It remains a staple in apothecary cough remedies on the left, but its sweet flavor and aroma also made Tolu balsam a common base ingredient for chewing gums, candies, and perfumes on the right. Tolu balsam proves that a botanical medicine can be a gentle and sweet-tasting protectant. Let's compare these two tools side by side. On the left, we have Vasaka. Its alkaloid compounds provide airway expansion while also lowering stomach acid. On the right, Tolu balsam uses esters to clear mucus while providing active germ defense and a pleasant flavor. When you stand in a pharmacy aisle today, the choices can feel overwhelming. You simply need to listen to your lungs and ask one question. Does your body need a mute button to silence a dry, painful tickle, or a broom to sweep out the heavy debris? The modern syrups found in pharmacies today use the same basic mechanics first discovered in these plant defenses. Effective treatment relies on matching the specific needs of your body with the biological tools nature has already built.